Hi, everyone. Welcome. We'll give just a moment for folks to come in. Okay. Okay, so we still have a few folks coming in, but for the sake of time, to keep our agenda moving, we're going to go ahead and get started. So first of all, good afternoon. Welcome to this Leadership Roundtable on Health Equity, Nature, and the Environment in Lake County. I'm Catherine Game, Executive Director of Brushwood Center at Ryerson Woods. And our mission is to promote the importance of nature for cultivating creativity, nurturing personal and community well-being, and inspiring learning. Brushwood Center believes in the healing value of nature and the arts. It's what we do. We transform that belief into practice with programs focused on physical and emotional health, artistic and music creativity, and community well-being. We work with more than 50 partners and 250 artists each year to support youth families, military veterans, and our communities here in Lake County. Brushwood Center is based in the 565-acre Ryerson Woods Preserve, and we honor this land as the traditional home of the Council of Three Fires, the Ojibwa, Ottawa, and Potawatomi nations. Many other tribes, such as the Ho-Chunk, Miami, Menominee, Sauk, and Meskwaki, also called this area home. We celebrate their traditions and culture and their immemorial ties to this land. And in honoring this history, we encourage each of us to rethink our relationship with the environment and the histories of all peoples, challenge the legacies of settler colonialism in our societies. It is with great gratitude that we welcome you to today's event. This Leadership Roundtable is a part of our annual Smith Nature Symposium focused on climate justice and healing. We invite you to explore the symposium, a series of programs, exhibitions, and concerts taking place through October, including a concert this Sunday with the amazing Cool Learning Experience students, poetry featured, as well as internationally renowned violinist Nadi Dreiblatt. The symposium series culminates on October 2nd with our award ceremony honoring Winona LaDuke, Indigenous activist and environmental leader. And while today's program is a part of the symposium, it's really the result of an evolution of community organizing and collaboration that has been in the works by and with many of you for years. We are now in a moment as we emerge from this pandemic where shaping the future with equity at the forefront is critical. Research shows that exposure to nature, as well as clean air and water, is essential to human health. But we also recognize that parks and preserves are often not safe or accessible places for Black, Indigenous, and people of color due to institutional biases, over-policing, racial profiling, and other systemic injustices, including industrial pollution and toxins. A recent study, though, by economists calculated just the mental health value alone of protected natural areas around the globe at $6 trillion. That's huge. We know that value in Lake County. We have beautiful preserves, parks, and lake shores, and a wealth of cultural richness and inspiring leaders and residents like each of you. We all want a healthier community for our children, and we can do more to make that a reality. And that is why we are so excited to hear from our panelists and engage in conversation with you today around these two goals. First, let's unpack environmental justice and access to green space as social determinants of health. And second, lift up the strengths of our community and the opportunities to break down barriers to systemic change that will improve the health of people and the environment. This agenda is the beginning of a process that we hope you will be a part of to curate a nature and health equity report for Lake County. And to start us off at this time, I'd like to introduce our Master of Ceremonies today, Mr. Marvin Bembry, who is the Executive Director of the John Maxwell team and longtime Lake County resident, corporate leader, and community member to lead us through our program. Marvin, take it away.
Thank you very much, Catherine. And what an honor it is to be a part of this incredible moment as leaders from around Lake County come to share their perspective. As a person who does leadership speaking and training, one of the things that I am fond of saying, it's a saying from my mentor, John Maxwell, which says, everything rises and falls based on leadership. And so it is incredibly apropos to bring to this conversation titular, political, civic, and community leaders to have a conversation, a real meaningful conversation with some practical potential outcomes about something that is very important. Over the last year, especially with all of the impact of the pandemic, the health pandemic, the racial pandemic here in this country, there's been an incredible amount of rhetoric that has been pointed to the issue around equity and inclusion. And so not as much perhaps about that whole intersectionality of outcomes around equity that have to do with the environment and with health. And so hats off to Catherine and her leadership and her organizations and those supporting organizations that are part of this event today for wanting to explore that intersectionality, but not only explore for the sake of exploring, but also be able to identify some tangible outcomes and next steps. And so it's my honor to serve you today. And we have several of our community leaders, the Honorable Representative Rita Mayfield, the Honorable Representative Dan Diedick, the Honorable Senator Adrian Johnson, as well as Ms. Catherine Gain, Executive Director of the Brushwood Center, who are going to share with us some of their thoughts from a leadership standpoint about this very important, vital, and timely issue that we're facing here, not only in this country, but even more specifically here in Illinois. To kick us off, I'd like to start with my long-term friend, the Honorable Representative Rita Mayfield. Would you like to kick us off with some remarks, ma'am?
Absolutely. First, let me just thank everyone for taking some time out of your busy schedule to do this. This is a very important subject that, and I've seen just from the list of individuals here, there's a lot of us that are, I don't want to feel like I'm preaching to the choir, but I believe that a lot of us are on the same page. Clear water, blue skies, fresh air. These are things that we believe should be equally available to everyone, but yet we know that if you live in certain areas around the state of Illinois, that you do not have access to those things that everybody should have access to: clean water, fresh air. We want to leave our children and our children's children with a sustainable environment. And that is something that we have not, that we have been working toward, and we're getting a little bit better. I do want to give a shout out to Dulce Ortiz, who is on the line. As many of you may have seen, we are closing the Waukegan coal plant finally, after years of it being just operating and polluting our air. Dulce, has led that charge. There was a lot, let me just thank there were a lot of advocates, a lot of people who went to Springfield, knocked doors, talked to legislators, but Dulce has stayed the course. There's been a lot of individuals who have come and gone throughout this journey. but she has stayed with me consistently. So can we please give her a big hand clap? Thank you, Dulce. Thank you for your advocacy. Thank you for just not giving up on our community and for truly believing that we could get this done. And it's because of your advocacy and individuals such as yourself, there's just way too many to name, but we're doing some great things here in Waukegan. With the closing of that, there's so much more that we have to address. What's actually going to happen with that plant and the space around it? How do we guarantee that that land is going to be reusable and that we don't have a fast one pulled over on us by NRG, the coal plant owners? So, we are watching them hard. Conversations with the Illinois Environmental Council, the Sierra Club, Clean Power Lake County, we're going to all be working together to ensure that we do leave something sustainable for our future. So again, thank you everybody for being here. And I just think we're on the right track with doing this. So thank you so much.
Awesome. Thank you very much, Representative. And now the Honorable Representative Dan Diedick, would you like to make a few opening remarks, sir?
Yes, thank you so much. And thank you to everyone for organizing this great event. It's really a pleasure to join everybody today. I agree with everything Representative Mayfield said, and I'll expand on it just a little bit. I'll give everyone a brief update on some of the work that we've been doing in Springfield to address these issues. The big one is we're in the process of putting the finishing touches on what's going to be a very historic and very important climate and energy bill. There's been different versions of it. It was called the Clean Energy Jobs Act at one point, and it's been combined with some other bills. And it's going to really revolutionize the way that we provide energy in Illinois and allow us to serve as a model for the rest of the country. It's going to end our use of fossil fuels. It's going to end the use of coal plants and natural gas plants in Illinois. It's going to invest in renewable energy. And importantly, it's going to make sure that we're focusing these new investments in the communities that have been most negatively impacted by our reliance on fossil fuels. Places like Waukegan, places like Danville and Rockford in East St. Louis, communities that have very large minority and low income communities that for a variety of reasons have borne the brunt on the environmental and the social and the negative impacts of our reliance on fossil fuel. So we're very close to getting that across the finish line, and hopefully by this summer or this fall, we'll be able to do that. One other initiative that we passed this year that I think the people on this call might find interesting is we passed a House Joint Resolution 6, which is going to create the Illinois Route 53 Expansion Land Alternative Use Task Force. The Route 53 corridor goes through Lake County. It's been earmarked for a big highway for a very long time, and for a variety of reasons. The reality is that that highway is just not going to happen. So we have to figure out how can we make best use of this land to serve the people who live in Lake County. And there's going to be a task force. It's going to be a collaborative effort where all the different stakeholders are going to come together. The local villages, Lake County, the Forest Preserve, legislators, and also community groups like the Tourism Bureau, environmental groups, conservation groups, sustainability groups. And we're going to figure out what to do with this really big piece of land. So it's not just sitting idle, and it's actually being utilized in a way that benefits everybody in Lake County. So with that, I will give it back to Mr. Bembry, and I'm looking forward to hearing the rest of the program. And thank you everybody for joining us today.
Awesome. Thank you very much, sir. We appreciate your comments, and thank you for your leadership as well. And now to our state senator for this community, the Honorable Senator Adrienne Johnson. I've known Senator Johnson for several years and have always been impressed by her passion and her commitment. So it's not unusual to see her wanting to be a part of this particular conversation and being able to add value there. With that, Senator Johnson.
Thank you. Greetings, everyone. Thank you so much, Marvin. And thank you, Catherine, for inviting me to be a part of this important roundtable. And to my fellow legislators and panelists and the audience, thank you for your time and attention and for offering your voice to this critical cause of exploring the intersectional solutions to health inequities, environmental justice and access, and COVID-19 relief. You know, I'm really honored. I was a staunch environmental and health equity advocate long before joining the Senate. And I am so honored to be able to continue to carry this out. And Representative Dittich mentioned the historic omnibus bill we're working on for energy. And that's something that's ongoing. But as Representative Mayfield said, it's a lot of advocates and leaders on this call who are very instrumental in why we are where we are today with the many changes. And just to focus on some of the activities in Springfield, I support legislation that protects our communities from harmful effects of pollution and ensures everyone has access, as Representative Mayfield says, to clean air and drinking water. And I had the pleasure of working with Representative Dittich on passing House Bill 644, which makes it easier for homeowners to install solar panel systems without worrying about delays and restrictions from property owners associations. I also proudly co-sponsored House Bill 158, and this is one of the pillars of the healthcare and human services pillar of the Illinois Legislative Black Caucus, and it makes sweeping changes to expand services and help improve health outcomes for the underserved communities, including provisions to ensure healthcare workers undergo implicit bias training in order to root out racial prejudice in the delivery of medical care. And I also sponsor a number of bills that I feel are interesting and relevant to this call today to improve mental and physical health outcomes for Illinoisans. Senate Bill 968 requires all Illinois insurance providers to cover medical necessary pancreatic cancer screenings starting January 1st, 2022. Also, Senate Bill 966 disallows Illinois and Wisconsin residents who are involuntarily admitted for inpatient mental health disorder treatment to be able to provide access to healthcare across state lines. And House Bill 2353 requires insurance companies to cover medical necessary colonoscopies after an initial screening without any charge to the patient as far as deductibles, co-insurance, or cost sharing. And then to better understand healthcare and barriers to care that our communities face, I champion House Bill 3504 requiring the Illinois Department of Public Health to administer a comprehensive Healthy Illinois survey every year to study and gather information on public health and health equity in Illinois. And this survey will ask a number of questions that are important to this issue on access to health services, chronic health conditions, diet, mental health, and physical activity, just to name a few. I'm really excited to be a part of this conversation, to listen, and hopefully to add some additional input. So thank you for the opportunity to be a part of this important event.
Thank you very much, Senator. And thank you all of our titular political leaders for the work that you're doing and the passion with which you are doing it around this very vital issue. And when I'm talking with corporate leaders about diversity, equity, and inclusion, one of the things that I talk about is the importance of commitment, and the importance of that commitment being based not only in the imperative around business, but also that personal alignment to values. So thank you, political leaders, for demonstrating and showing by your own personal commitment and the work that you're doing in terms of bills that you're sponsoring to make this a more equitable place for us all. We appreciate that. Listen, want to just say one word about housekeeping. If you're not speaking, please mute your line so that we can avoid any unnecessary background noise. And as some of you have already begun to do, thank you for putting your comments into the chat. We'd love that. And Catherine and her organization will be capturing all of these comments and taking a look at all of them. So if there's a great idea that you have or a place where you want to encourage those who are speaking, to consider something, go ahead and note it in the chat for us to take a look at later. With that, I'd like to introduce members of our panel who are actually going to take this a little bit further. Many of these are leaders in the in our community who are actually feet on the ground, advocating, fighting for, making decisions that impact health equity across the spectrum. And we're going to ask them a series of questions over the course of the next 20 to 30 minutes or so. And so we would invite you to really lean in and listen to what these passionate leaders have to say. We have the Honorable Angelo Cayo, who's the president of the Lake County Forest Preserve and also a commissioner for Lake County. The Honorable Mark Pfister, who is the executive director of the Lake County Health Department. Celeste Flores, who leads community building at Mano a Mano and also co-chair of Clean Power Lake County. Dulce, who you have heard about already, a community leader, director of Mano a Mano, co-chair Clean Power Lake County, who has been recognized for her tireless effort here. And then, of course, Dani Aboud, manager of community programs and partnerships at Brushwood. Wow, what an impressive group of leaders, an impressive panelists. These are actual people. These are not, you know, Google names. These are real people right here in our county who are doing the hard work of advancing an agenda strategically that's going to make this a more equitable place for all of us. So I'd like to just start our conversation and ask actually all of you to address this very first question that we're going to give to you. And that is, from your vantage point, from where you sit, your position of leadership, your place of influence, from where you sit, how does access to green space, clean water, environmental justice, how does all of that impact this notion of health equity here in our county? Let me ask that again. Each one of you view this process from a different vantage point. You're all doing different things, supportive, interconnected, they're intersectional. And so from each one of your views, how does this work around access to green space and environmental justice, how does that impact the issue of health equity here in Lake County? And with that, I'm going to go to our health director here, Mark Pfister. Would you like to speak to that first?
I'd love to, Marvin, and thank you for that. It's a great question. And when I think about that question, really, it comes down to what we work on every day here in Lake County. And I say that this is the community, we work on something known as population health. And what is population health? It really is something that considers the health outcomes of an entire population. So we're focusing on the vulnerable to reduce health disparities. And when we talk about population health, we're addressing these social determinants of health, which are social, economic, environmental, and behavioral factors. And when we look at those social determinants of health, we know that from a health perspective, to get to equity, that we have to address these determinants of health. Behavior has a part of it, medical care has a part of health, but really to get to health equity, we need to address social determinants of health. And some of those social determinants of health are lack of access to green space. We know green space is helpful. We know that a lack of access to fresh fruits and vegetables is going to impact health. Unemployment, violence, lack of education. If you have a lack of education, then that will lead to a lack of a living wage, a lack of having insurance. So your question really is a great one, is that those are both great things to address population health through addressing the social determinants of health.
Thank you very much. I think that I noticed one of our states recently, I think it was New York, that that illustrated that racism was a major cause of some of the issues that, and it was a public health kind of issue. And so the notion of your social determinants of health, behavioral, social, et cetera, take that into account. President Cayo, you have a very important role leading and influencing the county from the standpoint of its natural green space and its acquired green space. What's your take on that question, sir?
Well, thank you for the question, Pastor Bremery. I think that if you take a high level look at the underperforming communities, you will come to find that they are also the least connected communities to trails, to green space, to those types of forest preserves, even parks, and so on and so forth. So what we've done as the Lake County Forest Preserve is we have put one of our largest forest preserves in two of the largest minority communities here in Lake County, the Greenbelt Forest Preserve. We brought the environmental amenities to the minority community. And I've always applauded the Forest Preserve for that, where underperforming communities can now have green space, they can have open space, they can have trails. We've even have, and I believe, Pastor Bremery, when you were with Abbott, Abbott contributed a major amount of funding so that we could build the Greenbelt Cultural Center right in the minority community. So I must say that we have been fortunate here in Lake County, where we have brought those environmental and green space amenities here to the minority community. And that's how we have addressed this particular issue of the lack of environmental education and amenities here in Lake County. We have brought them to the minority community.
Thank you very much, sir. Celeste, would you speak to that? You're playing an influential role here, a leadership role there with your role as co-chair of Clean Power Lake County, but also serving with Mano a Mano. Speak to this issue that we're raising today about how access to green space and environmental justice, its interconnectivity to the issue of health equity here in Lake County.
Yeah, good afternoon, Marvin. It's Celeste. But, you know, I think for me and the work that I have seen here in the community that I have worked with, there are huge disparities. I think even as a county and as leaders, we don't have the same definitions when we speak on health equities and what does that mean. And I think there needs to be more conversation and more honest dialogue between community leaders and community members. You know, we know Lake County, we know the richness of it, but we also know the poverty that exists here. We see some very amazing natural spaces and spaces that I have taken youth to. You know, people don't know the amazing things that are maybe just, 15 minutes away, but 15 minutes away is a really far away if you don't have transportation to rely on. And that's what I've seen. I think we see the difference between the life expectancy if you grow up in Waukegan compared to Lake Forest, but also within the same, government agencies and other agencies and corporate polluters that haven't failed the community. And I think especially working a lot within the Latinx community, we see green spaces as something very different. It's not about going to that forest preserve. It's not going to the beach. It's about hanging out in the backyard with your family. And we don't consider that green space, but that is green space. That's where you first learn to be outside in nature. And I have taken so many people to our forest preserves. They're beautiful, but it's hard to access them. And then it's even harder if your first language isn't English to be able to participate in what's going on there too, right? I mean, I've had the privilege of working in the environmental field before working on Mano a Mano, and we did a lot of that. We went out to the forest preserves and partnered with some people that are probably on this call or colleagues of yours. But we need to desperately have our government agencies really take a look at how are they communicating with that population of Lake County that their first language isn't English. It's critical that everyone gets to enjoy this. And, you know, it's also sometimes very weird because you want to take people to green spaces and then you have to pay for that access, right? And having to think about that. So I'm excited to hear more from other people and the work that they've been doing and how we can come together to really make sure that there's actual equity in accessing these green spaces.
Excellent. Thank you very much, Celeste. Dulce, why don't you speak to that as well? You've been given some kudos so far already in our session today. You obviously have a heart and a passion for this. This is not just a nice thing to do. It's something that you felt passionate about that must be done. Unmute yourself, Dulce, and go ahead and share your thoughts.
Yeah, thank you, Marvin. Well, first of all, I just want to thank Catherine and staff in the Brushwood Center for putting this together. I think in all of the years that I've been involved in community, this is the very first time that an event like this has been created. And obviously, it's needed now more than ever after this pandemic has ravaged the Black and Brown communities. We see that there are additional factors as to why COVID-19 was, or why COVID-19 disproportionately impacted Black and Brown communities. And I think what I want to make note is that, last year at the height of the pandemic, although only 22% of Latinos made up, total Lake County portion of the Lake County population, 48% were infected. That was the infection rate, 48%. So that was, working as the executive director here at Mano a Mano. We were pretty much, our staff were working nonstop to be able to provide, our community members with basic necessities because they were impacted, with their jobs, reduced hours, they got sick, they were ill. And when we think about, specifically the Latino County residents, we know that there are most essential workers, service workers. They have little to no access to healthcare. They have limited social safety nets. And there's also fear, right? The fear that we underwent the past 4 years under the previous administration. It was something that really was traumatizing for our community members. And so when you take that into consideration with factors that, had already been in place in our minority communities. And Commissioner Angela Kyle, with all due respect, I don't think our communities are underperforming. I just think they're more on survival mode because of the systematic racist systems that we have, the oppression that we've lived and endured. And so I think that our community members try to do the best that they can with what they have. And it's really hard for them to advocate for themselves because when you, as Mark Pfister mentioned, when you have low wage jobs, when you have no benefits, when you really have to dig deep just to make ends meet, it's really difficult to advocate for oneself. And so I feel that, I sit in a place of privilege where I'm able to advocate for others. And when we talk about, the access to green space and about environmental justice, I think that, those are, green space sounds wonderful, but, as Celeste mentioned, it is just not feasible for some of our community members. And I just want to close with this, our Mano a Mano has a satellite office in North Chicago, and I was tasked last year to do a weekly drive down to Highwood to purchase gift cards from a local grocery store so that we could give out to our community members that were in great need of, getting their basic necessities such as food, prescription medication. And so in my drive there, I did feel a sense of anger and frustration because I lived in Waukegan for the majority of my life, 20 plus years. And driving through Lake Bluff, through Lake Forest, all those beautiful areas that do have, the bike lanes, they have the walkable paths, have a coal plant in their lakefront. We can really see, the inequities and why an environmental justice community is called an environmental justice community. And so I think that, we all are deserving of basic human rights, access to clean air, clean water, clean soil. But in addition to that, we can't stop there. We have to use our place of privilege to do more advocacy to ensure that our community members, especially in EJ communities, are awarded livable wages and that they have access to quality health care and that they're able to thrive and have that self-determination that we all really must have.
Thank you. Thank you, Dulce. We'll conclude this first question with Danny from Brushwood Center. What are your thoughts, Donnie, about this issue of access and and the resulting impact in terms of health equity here in Lake County?
Absolutely. Thank you, everyone. And thank you to my fellow panelists for everything that's already been said. It's always hard to follow Celeste and Dulce in anything. But I guess the biggest thing I want to point out, a lot of the work I do for Brushwood Center is working with youth and families across the county, many of whom are in overburdened EJ communities. And, the real thing is proximity doesn't always equate to access or being made to feel welcome in a space. I see a lot, especially in the larger environmental sphere, this temptation to assume that populations from overburdened communities or immigrant communities don't know about engaging with the environment, and that's why they're not coming to programs, or that's why they're not going to green space, and that they're not aware of the health benefits of it. But that's just not true. I work with students who've never been to Ryerson Woods before, but they know more about birds than I could possibly teach them. They're stopping me every 10 seconds to tell me all the things they already know. I work with families who grew up tending ancestral land, who have rich, storied histories and connections to nature. But that kind of knowledge, that indigenous knowledge, that intuitive knowledge isn't valued the same way in environmental circles. We have this legacy of racism and exclusion in this field that keeps people out because their knowledge doesn't come with a PhD. It comes from hands-on labor and experience with land and being a caretaker of it. And so, like Celeste said, the ways that we allow people to engage with our natural areas aren't accessible in all cases, be it a lack of Spanish materials or a fee, or just this attitude of knowing more, of bestowing some kind of knowledge onto populations who very likely have a deeper connection to nature than you could possibly understand. The other thing I'll say too is, it's really exciting to have these big wins like the closure of the coal plant, but as everyone has mentioned, it's not the end. Health equity isn't limited just to the closure of the big bad, but what happens after that transition, the just transition that folks like Celeste and Dulce fight for. There have been so many studies over the last few decades that explore the gentrification that can come from sustainability projects, from environmental remediation projects, that fail to meaningfully engage communities and local populations, or just refuse to be community led. You've seen it at the High Line in New York, the 606 bike trail in Chicago. Recreational spaces are important, green space is important, like Dulce is saying, but we know that they've been limited to certain populations on purpose, and we can't just suddenly build them in communities and expect health equity and racial equity to follow. And there have been studies done that show that it doesn't. Oftentimes, what can happen is displacement of current residents, driving up of prices, creating spaces that further marginalize those who are already most vulnerable. So when we talk about nature equity, what it's really about is centering frontline communities, centering overburdened communities, and making sure they don't just have a seat at the table, but they're making the decisions that impact their communities. And it can't just be, the folks who already run the spaces, who already have the access and privilege, making big decisions for entire populations.
Thank you, Dani. So, ladies and gentlemen, we've heard from some very passionate advocates and leaders in this particular space, as evidenced by the way and the depth of which they answered these questions. Unfortunately, because of time, we're actually running out of time with regard to being able to dive deeper. However, I would be remiss, and I'm going to ask our panelists now that are interested in answering this very last question that I'm going to ask. I'm going to ask you to really do it in a soundbite, like no more than 60 seconds, okay? And I know that's tough. I know that's tough, because the question that I'm going to ask you is really the question about kind of where are our specific opportunities? What are some specific things that we can do, right? I really don't like being part of, conversations that just pontificate on the problem and give no opportunity for specific next steps, all right? What are some things we can do? What are some things you're challenging those that are part of this conversation today to do? Recognizing that this is a process. This is not something that's solved just because, Catherine leads an incredible session today, right? This is a process. So I'm going to ask our panelists to speak into this question. What's something that each one of us can do from your vantage point to help move this agenda forward?
I can be really quick, Marvin. I have it.
Don't say.
Really quick. Pass the Clean Energy Jobs Act.
Okay.
Call Senator Harman, call your state senators, and let them know how important this is, not only for environmental justice communities, but we are going through some really rough, difficult times dealing with climate change, and it's only going to get worse. And we have to decarbonize the state of Illinois. This is the most historic energy piece of legislation. So please contact your senators, contact Senator Harman, pass the Clean Energy Jobs Act. Really easy.
Real easy, just like that, right? Don't say, just pass it, right? Excellent, thanks so much. All right, who else would like to, from our panel, kind of speak to that question of, so what can we do now? Having identified some of the challenges, ever-present, omnipresent challenges, successes, a few wins. But what are some things that we can do specifically, and what would you challenge all of us to do? Dulce has given us the real simple one, just pass that act, real simple there, right? All right, who else?
I'll take a stab at that one.
Please, President Kyle.
Thank you. Well, the Lake County Forest Preserve District has a 100-year vision for Lake County. One of the key strategic directions for the district is public access and connections. The purpose, I'm sorry, my phone. The purpose of this strategic direction is to improve the quality of life for Lake County by increasing equitable access to district lands, to forest preserve district lands, facilities, programs, and services for all of our communities. The district is also working on connecting communities such as Zion, Waukegan, and North Chicago through a trail system that ties into a larger regional system. One of the main barriers is that the strategic land acquisitions necessary to achieve this system can take a while. But that's what we're trying to do, is to give the public more access to the forest preserve systems, to the trails, to the savannas, to even the shelters, the picnic areas, and so on and so forth. So we are trying to disbarge the barriers from the forest preserve system so that we can have equal access for everyone.
Thank you, sir. Thank you. Celeste or Donnie,
Yeah.
Danny or Mark, what are your thoughts on some tangible opportunities? So far, we've heard pass the legislation. We've heard that the Lake County Forest Preserve is working to improve access to lands, interconnecting communities, connecting communities for access. What are some other things that we can do?
Yeah, I mean, I think getting involved in whatever capacity that is for you, I think it's going to take everyone to address climate change, and we address it in a lot of ways. Obviously, here we've been focusing on energy and green spaces. I know in the chat, we've been talking about other things, but you know, I think getting involved, listening to local EJ leaders in your community. I think Lake County is so diverse and each community is so unique. And so the solutions need to be unique, and it has to be coming from the people that are living that day to day, educating yourself on this topic and going to educate others, and using the privilege that you have to show up, to advocate, and to make sure that these comprehensive plans that government agencies always come up with, that's taxpayers' money. You know, we pay to have the Lake Forest Reserve. We should have that access. So let's make sure that these comprehensive plans are seen through, that we show up to the meetings, even if it's at 9 a.m., right? Use that privilege of being able to go to that meeting during work hours and being there to advocate for the community members that work from 9 to 5 at a factory and are unable to be there to say what they want in their community or advocate for those meetings to change. I know that's something that's happening at the Lake County level. I don't know if it's gonna happen at the Forest Reserve level, but getting involved wherever you're passionate and making sure that you're bringing people along with you.
Thank you very much, Celeste. Mark, as the leader of the county health department, kind of give us some thoughts, some tangible, because you're seeing both the impact of health inequity and you're seeing it on a daily basis. Your clinics are serving populations that are severely and significantly impacted. Talk to us about some things, some next step opportunities, not only for the health department, but also what you would encourage those on this in this particular conversation to pursue.
Yeah, thanks, Marvin. And again, I really appreciate you bringing up, you know, racism is a public health issue, and we have a lot of structural racism in Lake County that we need to address. And one of the main ones that I think we can solve some of our problems here in Lake County by actually reforming how we fund education. And so if we do that simple thing, not base education on the assessed valuation of the areas those districts are in, but come up with a different funding mechanism. Again, education equals jobs, jobs equals living wages, jobs and living wages equals access to care. And as you said, I mean, we are a provider of access to care, that we serve all regardless of their ability to pay. But ultimately, you know, that also has to change. Our access to care in the United States is that we need to come up with a different modality for that. But I think Celeste said something really good, is that we want our communities, you know, everybody has an innate desire to be part of nature, to, you know, that's called biophilia, is that, you know, we have that innate desire to be a part of nature and to live for, you know, look out for life. But I think this is where Live Well Lake County is an example of something that many of you are already a part of. And We want you to be a part of that, bringing your voices, because really we will not have change until it's community driven. So we need the community to help drive. And then also I did put into the chat link, a website just to look at some of these social determinants of health. Many of them are not going to be a surprise to you. I mean, we know where the health disparities are in Lake County. We just need to address those social determinants of health to make sure that we're changing the health outcomes of our population.
Thank you. Thank you, sir. Finally, Donnie, what are your thoughts?
Yeah, I think I really think Celeste hit the nail on the head in saying that what we need is equitable access to decisions being made. Folks who can't make a community health meeting or a public forum because it's in the middle of a workday, that's not their fault. The fault is on the people who decided to make the chance for communities' voices to be heard at a really inaccessible time, right? So I think especially for those of us in organizations that have power, that have privilege, it's our job to make sure that we are focusing on community-driven opportunities, focusing on community voices, and making things more accessible. That means putting materials in Spanish broadly across the board, providing interpreters for important meetings, and making sure that we have opportunities for folks who work 9-to-5 jobs to have their voices heard. And that's not just something we're putting the onus on the constituents for, hoping that they show up, hoping that they come to these meetings, but that we're making it a priority. Gosh, my headphones keep falling out. Make it a priority that we are seeking out those voices, that we are not moving forward until we have those voices heard, until we have those opinions on the table.
Wow, thank you so much. There's been a lot said here, and we're going to continue this conversation in our breakout session. So you'll have an incredible opportunity to go a little bit deeper. Obviously, this is such a huge topic. It's systemic, it's structural in nature, and it's intersectional with so many other things. So the fact that we're broaching the conversation today does not mean that it's solved or that the issue is over. So thank you very much. Those of you that are participating in the chat, those of you that are, proffering ideas, suggestions, questions, all of that's part of this ongoing process. We're going to go ahead and break for our breakout sessions. And each session will have a leader in that particular session. And we're going to dive a little bit further about some of the barriers and also what are some of the things that we can do to advance this discussion forward. Time dependent, we'll have an opportunity to do a quick, maybe 30-second kind of report out of each one of these sessions and then talk about next steps. So with that, I'll turn it over to Catherine and company to break us out into our groups. In your groups, focus on what are the barriers, what are the assets that exist right now, coexisting right now, right? And what do we need to do to address these issues? Those are the two questions to talk about in your group. Thanks so much.